the onset of new strain of coronavirus, which has triggered another wave of fear and anxiety in people, everybody is wondering as how different is this form of virus, and are people more at risk of getting sick? What are the symptoms, and what is to be done if anyone shows such symptoms? Will COVID-19 vaccine still work on? Are there any new different things which we should be doing to keep our family safe? My name is Sanjay, and today I will answer all these questions for you. So stay tuned and watch the video to the end. Well, if I ask ourselves that how different is the form of virus, what we know by now is that these viruses and the variants of this virus occurs when there is a change or a mutation to the virus genes. All RNA viruses mutate over time, including the coronavirus causing COVID-19 pandemic. And it's neither new nor unexpected. Well, as per some recent reports, the genetic changes which has been noticed in some of these new variants of coronavirus has shown to be more infectious than before, and therefore may cause more severe illness than earlier versions. Now, if you ask, are people more at risk of getting sick? Well, to be more precise, as I mentioned to you earlier, that there are some preliminary evidences that suggest that these variants are more contagious because of the reason that these mutated versions actually seems to affect the coronavirus spike protein. Now, this spike protein is actually which covers the outer coating of the SARS-CoV-2 virus and give them the characteristic spiky appearance. Okay? Now, these proteins helps the virus to actually attach more tightly to the human cells of the nose, lungs and other parts of the body. And there is always a chance that people with comorbidity will have a higher risk of getting infected and the increased mortality. Now, talking about the question whether the COVID-19 variants affect the children more frequently than the previous one or not. Well, as per the experts, there is definite increase in the cases in children, but the data shows that the kids are being infected by old variants as well as the new ones. So there is no such convincing evidence that actually can tell you that the newer variants have a special propensity to infect the children or cause disease in children. Okay. However, we need to be a little vigilant and we need to monitor such shifts. But at this point, we can just be speculative. Well, another very important question which people keeps asking is what are the symptoms of this newer variant of coronavirus? Are the symptoms same as the original version? And what is to be done if somebody gets such symptoms or shows such symptoms? The new COVID-19 strains have actually exhibited similar symptoms to that caused by the original version, but definitely have some new ones too. Well, as we all know, the usual symptoms of COVID-19 includes a continuous cough, chest pain, fever, loss of taste and smell, aches and chills. Apart from these usual symptoms, the new COVID-19 strains have actually reported nearly new 7 symptoms, which includes conjunctivitis, diarrhea, discoloration of fingers and toes, aches and pains, sore throat, skin rashes, headache. And if anyone shows such symptoms or such symptom develops, they should actually follow these following steps. The first thing what they need to do is self-isolate themselves. That means staying at home and staying away from the other family members to avoid spreading the virus within the other family members as well. It will be ideal if the people who have symptoms of COVID-19 remain in one room and use a separate washroom to avoid, spread to the other family members. Okay, and if needed, a person should contact the doctor by phone and report them about their symptoms and seek further advices. They should not, it's very important that they should not show up at the doctor's office or to the hospital without a prior approval from the facility and the doctor. People should call the emergency service if the symptoms are severe, and it includes like breathing difficulties, so on. But there is another thing that is called the practice of self-care. Now, as we all know, at present there is no such treatment of COVID-19. So one should take measures to prevent the complications which can arise by this COVID-19 virus. So you can drink plenty of fluids to keep yourself hydrated, eating a healthy diet to keep your body fight the infection, getting plenty of rest to aid recovery, taking medications to ease the cough, using paracetamol kind of medications to lower the fever and alleviated aches and pains. It is important to monitor any symptoms and to take action immediately if they begin to get worsen. Now, if a person begins to develop breathing difficulties, they should call the doctor or the hospital for immediate guidance. A person should call the emergency service if the breathing difficulties are severe and it's getting worse. Alright? But now there is another major question which is widely being asked, like, is COVID-19 vaccine, which is widely available right now, will still work on the newer variants? Well, to answer this question, let us first understand what are vaccines. Well, vaccines are pharmaceutical formulations containing tiny fragments of disease-causing organisms or the blueprint of making the tiny fragments. They also contains some of the other ingredients to keep the vaccine safe and effective. Now, these latter ingredients are actually included in most of the vaccines and have been used for decades in billions of doses of vaccines. So you can be rest assured that these are really, really safe. Now, each of the vaccine components serve a specific purpose, and each ingredient, as I said, is tested in the manufacturing process very carefully for its safety. Now, as per some initial reports, the effectiveness of COVID-19 vaccinations is definitely being impacted by the emergence of the SARS-CoV-2 variants. Now, this could become more problematic as these virus continues to spread, increasing its chance to mutate. However, it is very important to note that despite the presence of these variants in the population, the vaccines are still likely to prevent severe outcomes such as hospitalization and death. So, as such, the naturally recovered COVID-19 patients should also consider getting vaccinated. Vaccinations can definitely offer a more consistent level of protection and more robust immune response to neutralizing these antibodies. So I'm sure you might have liked the content of this video, and I was able to clear many of your doubts in regards to the newer version of the COVID-19 and regarding the effectiveness of the vaccines on the newer versions. Right, and as well, some of the newer symptoms which you can experience if somebody gets infected with the coronavirus. So if you have not subscribed to my channel Pharmatech Solutions yet, I would request you to subscribe it so that you keep getting the updates whenever I upload a new video. So promising you to see you again with another interesting video. So till then, take care, have a nice time, Stay safe, stay healthy. Bye bye.